In the U.S., the loss of blood is the leading cause of death for trauma events during emergency responses.
To help combat the growing issue, UW Health implements a new tool to treat massive blood loss called whole blood. First responders would typically use IV solution like saline to keep blood pressure up during emergency drives to hospitals. Type O whole blood can provide trauma patients better results of survival before arriving at hospitals. According to UW Health, 85% of the 30,000 preventable deaths happen before reaching hospitals.
What the military learned and is demonstrated is that whole blood, we can safely give that to a person before they get to a hospital, and it has all the components in it to slow down bleeding and temporize bleeding, including platelets. And so why that is important is what the research showed in military combat casualty care and recent trauma centers is if we can start resuscitating within that first hour, it allows us more time to get you to that trauma center for the resources.